teach session, I'd just like to go over the learning outcomes, the assessment criteria and the right to appeal process. This will just make sure we're both clear on what's being assessed and how the process works, so you know exactly what to focus on during the session. So the session you're delivering today is part of the unit Understanding and Using Inclusive Teaching and Learning Approaches in Education and Training. The main learning outcomes for your Micro Teach session are: 1. Understand the principles of inclusive teaching and learning approaches. 2. Be able to apply inclusive learning strategies in practice. And 3. Be able to assess the effectiveness of inclusive teaching and learning approaches. The assessment criteria: you need to devise an inclusive teaching and learning plan, identify and apply appropriate teaching and learning approaches, resources and assessment methods to meet individual learning needs. You'll need to demonstrate effective communication with learners in a way that meets their individual needs, and you also need to provide constructive feedback to learners to meet their individual needs. It's important to remember that you do have the right to appeal any assessment decisions made today. If at any point during the assessment you feel that the assessment was not conducted fairly or that the feedback provided was unclear, you do have the right to submit an appeal. If you want to submit an appeal, you must submit a formal written appeal to me within 5 working days, clearly stating the reason for your appeal and any supporting evidence. I will review the appeal in detail and provide a response, either agreeing with the concerns raised and making adjustments, or providing an explanation as to why the assessment was conducted as it was. If you're still dissatisfied with the outcome after my response, you can escalate it to the awarding body, which is Focus Awards, who will then conduct an independent review of the assessment. It's important that this process remains transparent and fair for all parties involved. So, with that explained, are you ready to proceed?
Yeah.
I'll now hand over to you.
Good morning and welcome, guys. Today we're going to be just discussing the essential safety protocols in the dermal filler treatment process. So the presentation that I'm going to share with you today will cover everything from hygiene practices to identifying contraindications and the importance of post-procedure care. I'm Sam and I'll guide you through the safety protocols to ensure we're maintaining the highest standard for patient safety and comfort. So before we get started, have any of you guys performed a dermal filler procedure or observed one before?
Yeah. I've seen one.
Cool, brilliant. So what safety protocols do you think were important in that type of treatment?
Well, definitely keeping the area clean.
Yeah.
Cross-contamination control?
Yeah, brilliant. So they were both great answers. There's lots that goes into making sure that we follow the correct safety protocol. There's lots of reasons why it's really important, and this course is designed to help you really get to grips with that and understand it in detail. So, by the end of today's session, you're going to be able to understand key safety protocols for dermal filler procedures. You're also going to be able to recognise contraindications and signs of potential complications. And finally, we're going to explore hygiene practices and the importance of sterilisation in dermal filler procedures, ensuring optimal client safety. All makes sense so far? Yeah, fabulous. So that's our learning objectives, but by the end of today's session, what do you think you'll be able to understand and apply more in relation to dermal filler safety?
Hopefully more sterilisation techniques and making sure my mind's the most safe that we can take.
Anthony, are there any specific areas you're
Basically the same as Adrian.
Perfect, great. ensures that you have an effective and safe outcomes in the dermal filler procedure. So protecting our patients, we're going to prevent against infections and ensure positive outcomes for them. We're also going to be making sure that we keep up to date with compliance and that we're not doing anything that we shouldn't be doing, that we're following all regulations and protocol. But we're also going to be looking at how safety protocols can build that trust with the client, build that relationship with them. So it's not just about infection control, it's not just about following guidance, it's also about you having a relationship with your client and thinking about how safety protocols and following those affect that relationship with your client. So why do you think safety protocols are so important in this setting? So you've already covered some of this, but it'd just be great to still think about
Reputation for clinic.
reputation for the clinic. Yeah, most certainly. It's your reputation that's on the line. If you do something wrong, how is that going to spread by word of mouth potentially? Any other things of why safety protocols are really important?
Regulations and guidelines.
Can you think of any examples, like specific examples that you've heard about where poor safety protocols have been followed and maybe led to issues in medical procedure?
Incorrect injection techniques and both infections with poor hygiene.
Yeah. Yeah, and that doesn't just happen in aesthetics, that's any kind of medical procedure. So you hear a lot on the news about people maybe having certain surgeries, they don't go quite well, they end up quite poorly in hospital. So yeah, there is quite a lot that can go wrong if you don't follow these safety protocols. So importance of safety protocols, we are going to prevent severe infections if we follow these safety protocols. Hygiene is paramount in any medical procedure, and dermal filler is definitely not an exception. So let's go over some essentials here. So maintaining strict hygiene and sterilisation protocol is essential for ensuring safe dermal filler procedures, minimising the risk of infections and complications. Sterilisation of dermal filler procedures, which is something that you've both said right at the very beginning you want to get out of this course. So what is sterilisation? Sterilisation is that process of eliminating all forms of microbial life, including bacteria, viruses, fungi and spores, to ensure client safety. Why is it important? It prevents infection and complications within the dermal filler procedure. It also ensures a clean and safe environment for both yourselves and your client that you're supporting. So key steps for sterilisation. Always clean the area. So whether that means washing your hands, disinfecting surfaces. So we disinfect surfaces using specific cloths or disinfectants that are surface wipes. Our wipe of choice here is these Clinell universal wipes, which are great for things like our beds, any walls that we need to clean, and they are all equipment and surface safe. Also going to disinfect the areas that need to be treated, but the area that needs to be treated on the client is going to need a different kind of disinfectant to an area, say the floor or your wall. So you need to make sure that any disinfectants that you use on your client and the areas to be treated are skin safe disinfectants. So these will be recognisable by the pathogen or say whether they are safe to use on the skin. When we're using these kind of disinfectant agents with our clients, it's really important that we use the pump that they are provided with. That will help us put down any cross-contamination. And we're also using something sterile to be able to place that on the client's skin. So, sorry, I think we've got some, thank you very much. So we're using something sterile, something clean, something that is disposable, one use only for that client to be able to get that field. These are items that are easily disposed of after one use only with one client. They are specifically made just to be used once and then thrown away. They always come in sterile wrapping, so you know they've already been sterilised and they're ready to use straight away. If you can't get single-use items, you may have other items that are multiple use, and it's really important that you're cleaning them in the right sort of way. So, how would we clean the multiple use items? So, multiple use items, you can use autoclaves or chemical disinfectant tools. So that might be something like Milton sterilisation solution, where you just pop those items into that solution. It's kind of like a disinfectant, but it's made specifically to sterilise. Where you're using sterilising equipment, when you are sterilising equipment that is multiple use, make sure that you're thinking about all areas, so it's not just your metal instruments. It can also be the furniture, the walls, the work surfaces. Everything around us in our environment in which we're working with needs to be sterile. So again, back to the universal wipes, when we're thinking about, are we sterilising our furniture, walls, work surfaces? These wipes are great. So quick, easy, convenient, and they're easy to dispose of straight away. Cool. So how are we feeling so far? Have we been making sense?
Yeah.
Fabulous. Let's move on. So best practices. So always follow the manufacturer's instructions for cleaning and sterilising equipment. And this is also for disposing of equipment. If they are single-use items only use them one time with one client. Don't be tempted into reusing them and sterilising those. Always replace disposable items to maintain hygiene standards. Remember, aseptic technique is critical to prevent cross-contamination and ensure safe treatment of clients. So what do you think, if we fail to sterilise an item, what potential risks could that have?
Infect the client.
Yeah, certainly, because not all infections are visible.
No.
So if we fail to, if we think, oh, that's fine, we can just try that on somebody else, we fail to sterilise that, there could be things within inside the human body that we're not aware of, that are not visible to us, and we could be passing that on from one to the next. Adrian, what about yourself? What do you think would be, if we fail to sterilise, what would be the
Dangers of bloodborne pathogens.
Yeah, brilliant. Yeah, good use of words there. But yeah, bloodborne pathogens, exactly what we were just talking about there. So not all infections are visible. So if we fail to do this correctly, we are putting our clients at risk.
But when there are checks as well, if someone was to spot check us and they found out that, or if they came for a treatment and then they didn't see us sterilising or getting clean equipment, we'd be instantly failed.
Most certainly. So within the aesthetics field, you are governed and regulated by local authorities, local councils. If you're not following the right health and hygiene processes, you are going to run the risk of getting shut down. Also, again, thinking about that reputational damage. So, Anthony, if you come into the clinic and you see me using a needle on Adrienne and then coming to try and use that with you, how would that make you feel?
Absolutely disgusting, and I'll go and tell everyone and make sure I ruin your reputation.
Exactly. So, it's really important, not only for client safety, it's important for your safety as well, because, within this needle industry, you do run the risk of potentially getting yourself a pinprick injury, and you also run the risk of maybe, if you're not correctly sterilising things, you carrying that infection, putting your hands to your mouth and things. but also that reputation damage as well. Cool. So there is also other things to consider within this, so expiry dates on a lot of your products. So dermal fillers that we're talking about today do have expiry dates on them. They also a lot of the time come as single use, so when you open those packaging, they come with a device that is made for one use only, so no sharing of those.
So should we always make sure that this is in date as well before we use it? That's just common sense, isn't it?
100%, yeah. Anything that you are using within your clinic, whether that is on a client or just within the clinic, we need to be making sure that it is safe to use, it's in date, and it's all together. Any equipment that comes into contact with the skin or blood, we need to make sure that we are getting rid of that quickly, and we're using the right sort of material to be able to treat whatever we're treating. If we were to get blood on the floor, it's really important that we treat that straight away with bleach. But where there's no visible signs of maybe body fluid, we still need to be wiping down as well.
So we'll, after every single person, we'll do that.
After every single client, we will wipe down the area that they've been treated on, and then before the next client.
So we'll do it twice, basically.
Yes, 100%. And you'll also clean your practicing area at minimum twice a day. But any kind of blood spills, straight away we need to be
So say we come in the next morning, we've already cleaned from the night before, we're going to clean the beds down again before we use them, even though we clean them the night before.
Yes. So before and after your client, because there is just that, again, that risk of anything in the air, settling, something that you might have missed. It's always important. You just do it again before your client. It also reassures your client that you are following those clean, safe protocols.
Sorry, Sam, just to interrupt. Can you explain why you chose this teaching method for this part of the lesson?
Yeah, definitely. So I'm using the PowerPoint presentation with the images and the bullet points because I feel like the images will really be great for those learners that are visual. They'll be able to use those visual prompts to really get that message in. But again, with the bullet points, everything within the bullet points contains the key information. So again, it's broken down, it's structured, it's easy for my learners to take that information in and make sure that they're getting those key takeaways.
And how are you ensuring that you're meeting the needs of all learners, especially those with differing abilities or learning preferences?
So I will be engaging the more kinesthetic learners a little bit later on with some practical hands-on experience. I've also got my visual aids here to try and really bring to life what products we might be using, the reasons why, allowing the students to touch them, to understand the labels if they want to, and prompt further questions. We will also, like I said, practice in the next couple of steps. For any learners who are maybe struggling with particular concepts, I've allowed pauses for them to ask questions. And hopefully nobody falls left behind with going at a pace that everybody's understanding and happy to move on.
Thank you.
Perfect. Right guys, everything all making sense so far? Good. So, as we've said, to prevent potential infection, it's crucial to wash your hands thoroughly before starting any procedure. Now we've already mentioned additionally wearing PPE is going to be great. So PPE, what is that? So it's disposable gloves. So disposable gloves that are again one-time use only, you can use them on one client, you can get rid of them. It's really important with disposable gloves that you think about the gloves that you're using with clients. We have a lot of people who are allergic to latex. Latex allergy is quite high within the UK. So we use these nitrile powder-free, latex-free gloves. It cuts down on the risk of any out to getting the right safety protocols in place for your client. So when you are selecting your gloves, think about allergies, think about what's the best for you. Latex-free gloves are the best kind of gloves that you can use for this kind of procedure. So also with gloves, also with PPE, sorry, there are other parts of that. So gloves, face masks and aprons. Why do you think we would choose to wear a face mask?
If you've got any cold or anything, you passing that on to the person. Also, probably stop you from spitting when you're talking sometimes or something.
Yeah, no, yeah, you're totally right, totally right. So face masks are going to protect your client from anything that you've potentially got. Anything to add there, Jenny?
Correct you from your client because they might still come to their appointment poorly.
Yeah, yeah, so you might get clients who come to you, they've got a bit of a cough or a cold, it's going to protect you, it's going to protect them. And then your apron, why would we
Is there any blood splashes or any human juice, water, anything from the human, from the person, sorry, going on you, you can just dispose of that rather than it being on your clothes, which is a lot easier, so you're not taking any blood home with you.
Yeah, you're not taking them home with you, and also it's not realistic to keep changing your clothes throughout the day, so it's a real good compromise of making sure that you're clean, you're ready for your next client, with the apron. So, what we're going to do at this point is I'm going to show you how to correctly don your PPE, so how you correctly put that on, because there is a process in which you do that. So when you're wearing the PPE, the first thing that is crucial is the hand washing process. So you're going to wash your hands with soap and warm water, thoroughly making sure you get in between the fingers, behind the nails. You've completed a thorough hand washing process. You're also washing up your arm to your wrist area, a little bit further up. You're washing the whole of that area. Wash your hands twice using that technique. So soap, warm water, between the fingers, behind the nails and up the arms. You then need to make sure that you have rinsed all of that soap off your hands. The next step is to thoroughly dry your hands. So when you're drying your hands, you need to think about the tissue that you're going to be using. We've just washed our hands, we don't want to be having to touch any sort of surfaces and contaminate those hands potentially. So look at within your clinic, within your working environment, to have some kind of dispenser that is automatic or is making it easy for the tissue to come out. Does that make sense?
Is that the same for the gloves as well, like a dispenser for the gloves?
Yeah,
Like there is on the wall there.
so a dispenser for the gloves like that, and the box is fine, because when you'll find you're taking a glove, they tend to kind of pop out the next glove. So thoroughly wash your hands. The next part is to pop on, once your hands are washed, you need to pop on your face mask. So your face mask may come in a sterile packaging like this, and sometimes they come in boxes. Of course, yeah, you can have a look at those, no problems at all, no problems at all. You will be using those a little bit later on, so I'm going to complete this demonstration and then you'll be able to have a look yourself and then give it a go yourself. So your face mask will come in sterile packaging. Please don't open your packaging yet. You will open the packaging at the time after you've washed your hands and you're ready to service your client. So you just open that and remove that from the packaging. We then just pop it over our nose with the area that is got the tightening, and this just goes around our ears. Hopefully you can still hear me after I've put this on. So that's your face mask, and that's your second part of your PPE process. The next part of the PPE process is to pop on your apron. So single-use aprons are available to buy from a lot of the medical websites on the kit list, or you can also get them from places like Amazon. They're just plastic, which makes it easy for you to dispose of. Open that, place that over your is your gloves. So once you've washed your hands, popped on your face mask, popped on your glove, popped on your apron, it's time to pop your gloves on. Can you both still hear me?
Yeah.
So when you're popping your gloves on, as Anthony asked earlier, you pull them from the dispenser, and what you'll usually find, like I said, is that the next glove is ready to come. It's really important when you're selecting the glove, you're selecting the right glove size for you. If these gloves are too tight, you run the risk of them popping open when you're servicing your client. You run the risk of them breaking, and that's going to put you at risk. If they're too big, you run the risk of them sliding off. So they need to be the right size for you. You then need to just take them by the cuff, pop your hands in, be nice and dry around them. Make sure that they fit into your wrists, and then pop the same with the other glove. At this point, you're now ready to complete your procedure. Nice, safe, and convenient.
Wearing a hairnet, is that optional? Maybe some glasses if you want it in case maybe it's squirting in your eye or something.
So yeah, things like hairnets and eye coverings are optional. I'm just going to pop this mask on. Are optional, just purely because the risk of the treatment that you're carrying out. So for certain treatments, like maybe laser, it's imperative that you wear eye protection. If you were just doing dermal fillers like we're looking at today, the chances of something going in your eye and then also you wouldn't suggest that you wear any sort of eye covering. Your hair does need to be tied back, so probably not come with the best hair today, this demonstration, but make sure your hair is tied back off your face. You don't want to have that trailing in your client's face or anything like that. Okay, so once you've got your PPE on, completed your procedure, it's then really important to make sure that you dispose of this correctly. So, as we said earlier, you need to dispose of it in the yellow bin. So everything will go immediately into there. I'm just going to pop over there and get rid of all of my bits and bobs. So, I'm removing that. Oh.
Is there a particular order you would remove it or?
There is, yeah. So we would remove the apron first, and then we look to remove your gloves. So when you are removing the gloves, there is a technique to do that.
Sorry.
quickly.
Oh, maybe
Alright. Do you need some water on it?
please.
Yeah.
Sorry to disturb you then.
No worries, no worries. Let me just introduce all taking the gloves off so that you've seen that, and then I'll go grab you some water. It's a little break. So when you're removing the gloves, remove them from the cuff, pull them inside out, and then with your other hand that's now de-gloved and holding the glove that you have just taken off, you need to make sure that you pull that, kind of wrap them up so that they're together and inside out, and then you can just pop them in that pair of bins.
So you never take it off in the treatment area, you always go to your bin and take it off outside, right next to
Yeah.
it, so go straight in there.
Yeah, definitely take it straight off because you don't know what's on them. You don't want to be kind of just leaving them sat around. It's better, anything like that, just get rid of straight away. Anything that could potentially have been contaminated with human fluid waste, we need to get rid of straight away. Anthony, I'm just going to go and quickly grab you a drink of water. We don't want to die of anything.
Oh, thank you.
Speak.
That's quite a sorry. Yeah. It's weird, isn't it? You wouldn't think that you'd have a mask on in this area.
So it's all to do with this keeping it sterile. It's actually going to remain sterile even though it's wrapped
So
in
they've obviously, there must have been some sort of treatment on that mask when it's before it's left the factory. that's got a date on it that can
It's
run
only
out
gonna
to stop
last.
protecting
Yeah.
you, basically.
Yeah, perfect. Right, how's everybody feeling? Yeah? So, PPE. Obviously, I have just demonstrated how we would don or put on that PPE. And I did that in a very specific order. Does anybody know why we would put our PPE on in that certain order?
To stop cross-contamination again, maybe you touch that and done that and you touch this and spreading
Yeah.
any germs that could have picked up, possibly.
Yeah,
Even though you wash your hands.
yeah.
So your gloves last so that you're not touching anything else.
Yeah, exactly that, guys. So your gloves are going to be the main thing that you are touching your client with, so they are the biggest thing that we need to protect. There is always going to be potential for, airborne pathogens, some kind of, but you're doing everything within your power to stop that
You basically want to
infection.
minimise what you touch with them gloves, only the equipment, basically. That's
Only
it,
the
nothing
equipment
else.
and your client, yeah.
I have a question. So if I put my gloves on, would I be back taking on my before and after pictures, before I put all of my PPE on, and then go wash my hands and then gloves?
So there's, I suppose this would depend on how you're taking the photos. If you're taking the photos and doing your client consult without touching the client, then you don't need any gloves. If you're going to be touching your client at any point during that process, you need at least one glove with the other hand on your phone to potentially use this one to touch your
Okay.
client. Does that make sense?
So if you're taking photos and you've got your phone in this area, and you've got an wipe your phone down.
So
Does that
your
make
phone
sense?
should be
So if
wiped down,
if
yeah.
you're bringing equipment, so be realistically, I wouldn't take the pictures like that because of contamination, as you explained. You know, it's just.
Yeah, so for insurance purposes, you will need to take photos. Your phone is probably a really good example of where we need to be thinking about the things that we bring into our clinic, how they can potentially harbour germs, harbour bacteria. Your phone's a really good one to think about. How are we wiping that down? You can use no wipes on your phone. It's going to have the same impact as it is on your bed and things. Remember that your phones are very dirty, so when you are taking those before photos, be conscious about this is in my right hand, my gloves on my left hand, I'm not going to pop that phone into that hand and potentially compromise that. But also I'm touching my clients and I need a glove. I need to protect them else.
Okay.
Does that make sense?
Yeah.
Cool. Are you both comfortable to move forward?
Yeah.
Yeah. So ensure the treatment area, like I said before, is fully sanitised prior to injections. Includes disinfecting surfaces and tools to prevent contamination during the procedure and reinforcing patient safety. So if we don't clean, disinfect this area before we start injecting, we're running the risk of moving that infection from one place to the other. However, looking at this picture, are there any thoughts that it provokes when we're thinking about sanitisation and completing this kind of procedure, this dermal filler procedure?
I just wanted to do it on my client.
Okay, well, why would you not do it on this time?
It's easily spreadable, that is it?
Yeah. I don't want to potentially spread the infection further. It's probably going to cause a lot of trauma for those as well because it looks maybe like a cold sore.
Yeah.
And I'm putting myself at risk as well because they are contagious.
Exactly that, Adrienne. So this looks like a cold sore to me as well. Anthony, as you said, you don't want to be spreading that around anywhere else. You don't want to be putting yourself at risk. You don't want to be putting the client through any medicine either. So we are going to move on to understanding a little bit more about that a little bit later on, so the contraindications, but it's great that you've already got a little bit of that knowledge ready for that section. So after any procedure, properly dispose of needles and single-use items is vital. Make sure that we're getting rid of anything that's single-use. Needles should never be multiple use. Equipment should be sterilise between clients, maintain a safe treating environment for future procedures. So, Anthony, back to your point a little bit earlier on, you know, when should we clean straight away after the client, but also clean again before the next client. And then we are really sure that that client has got the best possible start to their treatment journey. So, contraindications for dermal fillers. Told you the herpes would come back, the tonsils. So, contraindications. Contraindications basically means anything that is going to stop you from completing that treatment. So for this section, I do have a really detailed report of the contraindications that we might come across. So the types of patients that we might come across that we are not going to be able to treat, or we may be able to treat them but we'll need to amend treatment ways in a different sort of way. So, contraindications include active infections. So active infections like herpes simplex, or most commonly known as a cold sore. We can't treat clients who have cold sores because it can lead to other complications. It can lead to that spread of infection.
So that any, even if it's not a cold sore, any sort of like cut on the lip or anything, you just wouldn't treat them. It's common sense not to do it because
Exactly.
you might aggravate it.
Yeah, you can have aggravate what they've already got there, or it could just lead to further complications. You could spread it and it could be doing something that we shouldn't do. So any kind of visual active infection, we need to decline treatment and look at doing that at a later date. Some autoimmune diseases like lupus as well, they are contraindications because they can interfere with the healing process of your body actually. And then also people with allergies. So if a client comes to you and they have a known allergy to hyaluronic acid, we know that hyaluronic acid is the primary ingredient within a dermal filler, so we would not treat that client because we know that we're putting them at potential risk if we did so. Lidocaine, which is in some fillers, which is like a numbing agent, is also common for people to be allergic to. So we know that they're allergic to lidocaine, we wouldn't go ahead with treatment as a contraindication. Just thinking about contraindications, what other things off the top of your head might be a contraindication of a dermal filler treatment?
Bleeding disorders or blood thinners?
That's literally what I was going to say.
Yeah, so why would that be?
It could be that, wouldn't it?
Yeah. 100%. So we're putting them at risk because their blood's a lot thinner, they're bleeding a lot more, so we're not going to
What about the pregnancy? Is that why you couldn't be doing that? I know it's common sense.
So yeah, so fillers during pregnancy or breastfeeding, we shouldn't be administered just because we don't know what that might do for the mother or the unborn child. You know, the hormones are very different during pregnancy. You don't want to be treating them with something new, introducing something new to their body, but also for an unborn child, we don't know what that's going to do to those. There is also legislation around treating children under the age of 18. Injectable treatment shouldn't be administered to anybody under the age of 18. And again, that's just morally they need to be able to make an informed consent about what treatments they're going to go through. So there is law and legislation that we cannot treat under 18s. Recognising contraindications will help you prevent adverse reactions during the treatment process. So recognising them, it's going to stop us from getting any adverse reactions. You may still get adverse reactions though, because people don't always disclose that they've maybe had a allergic reaction, or they may not have been allergic or never had this kind of treatment before. So recognising the signs of the contraindications will also Understanding client safety involves recognising complications, as I've said, communicating effectively and ensuring informed consent, which is vital in aesthetics treatments. So even with the best kind of practices, like I've said, complications can sometimes arise. Some of the common complications include bruising and swelling. That's a very normal side effect and is typical of dermal fillers. It usually resolves within a couple of days, your bruising and swelling. I would say 9 out of 10 clients are going to bruise a little bit or swell a little bit because we're introducing something different to that. Infection is always a concern, especially if hygiene protocols aren't being followed. And there's also the risk of a vascular occlusion. So a vascular occlusion is rare, but it is very serious. It is basically when a filler is injected into a blood vessel and it blocks it, and that will cause the tissue to be damaged around it because the blood supply isn't getting into that tissue. And immediate action should be taken to counter a vascular occlusion.
Do you know if it, what vascular, is there a test to see or?
There is, yeah. So, that's actually one of my questions for you. So, what immediate action should be taken if you suspect that somebody has a vascular occlusion? Do you know?
999? Send them to the hospital. No, tell them to come in to see you and then obviously you look at it and then possibly dissolve the filler.
Potentially, but when you're asking them to come to see you, what do you think you're looking for? What are the signs when they're coming to see you?
Maybe redness, like a swelling in the area, redness or tenderness.
Adrienne, what do you think? What may be the signs?
Blemish of the skin, extreme heat or cold, you know, like where I've been. Numbness and tingling.
Maybe the blood flow not coming back.
Yes.
Refill that one.
Yes, capillary refill. So, you've obviously heard of that before, Adrienne. So, what is a capillary refill?
It's where you press on the skin and then time how fast it takes to come back. So it should be between 1 and 2 seconds, I believe.
Yeah, around about a couple of seconds. So, basically, if you suspect a vascular occlusion, the best way to be able to tell if that blood flow is getting to that area that you need is to apply pressure. Apply pressure to that area for a minimum of 10 seconds. And what you find is on a healthy, natural tissue, you stop that pressure, you can see straight away my blood is running back, it's maybe gone back now. Maybe try it on yourself, try it on an area of maybe your arm, your hands. If you apply pressure for an amount of time, what you'll notice is that the colour does go, but then you start to see it come back.
So if it was vascular occlusion, it wouldn't change, would it? It would
No.
stay the same amount of paleness.
If your body is not getting the right amount of blood flow, that's not going to happen. It's just going to stay that white colour. So, Anthony, you said that it may be going red, inflamed. It's more likely that it's going to go white because that is not getting the right blood flow coming through there. So to check that, we just complete a capillary refill. So pressure to the area, 10 seconds as a minimum. Reduce the pressure, is that colour coming back? In terms of other complications, have you guys actually seen any complications during dermal filler procedures?
Absolutely swelling and bruising.
Yeah, swelling and bruising. Have you encountered that yourself? You've had clients with families
I've
and
had it myself.
So what course of treatment would you recommend for swelling and bruising? What would you do in that situation as a practitioner?
My practitioner told me to take antihistamines for the swelling and apply arnica for bruising and swelling as well, because it's natural as well.
Yeah.
I found that really helped.
What about cold packs?
Yeah, so you could apply, yeah, exactly right. You could apply some cold packs, not directly to the skin, we don't want to be put in, and we need to make sure that we're maybe not doing it for too long as well. But yeah, it's a really good idea to apply that cold pack because bruising and swelling can be quite warm. So that's definitely nice for you to apply it. Adrienne, you mentioned that you practitioner recommended antihistamines. Why do you think that was?
Just to see if I was having an allergic reaction to anything. So she got me to sit down for an hour within the clinic and waiting for my antihistamines to work.
Yes, brilliant. Yeah, and that is a really good safety protocol for you to think about within this industry. Anaphylaxis is something that can happen to you, can happen to your clients, and having that understanding of potential adverse reactions is going to really support you in maintaining that safe environment. How's everybody feeling? All right. Any questions at this point?
So you said with anaphylaxis or allergies to lidocaine, does all filler have lidocaine or?
No, so not all filler has contains lidocaine. So lidocaine is a numbing agent and it's kind of added as a nice extra for your client, just for that comfortability for your client. But we are aware that some people are allergic to that, so you can buy fillers that don't present.
So that is an option for.
I've got a question for you.
Yeah.
After, so the vascular occlusion, sorry, so it'll be bruising, there'll be no blood in the area, it'll go white. What's the next stage? Is it necrosis after the vascular occlusion?
Yes.
The skin will die if
Yeah.
you don't treat it.
100%. Yeah, so it's really important that you recognise the signs. So what are the signs of a vascular occlusion?
White, basically a white mark in that area
Yeah.
because there's no blood flow.
Perfect, yeah. So no blood flow, so if we don't act, that tissue is going to die. So your role is to identify that complication by doing pulmonary ether, and then the next step is those steps of, do we need to do a dissolve? Is it an occlusion? Yes it is, we need to do a dissolve. And then carrying out that dissolve in the way that is described in your complications management training. So, client communication and informed consent. So, clear communication fosters trust between you as a practitioner and the client, and informed consent is crucial and should cover the risks, the benefits, and also the side effects associated with any treatments that your client's going to go through, so with dermal fillers. Ensuring that the client has realistic expectations around the outcome of their treatment is also your job and is also vital to that health and safety aspect, because you want them to really know what they're going into before they go into it. So, informed consent ensures that the client really does know what they are having done on them, what could happen, what the benefits are of that treatment, but also what the side effects are. And it also includes your post-care, so what to be looking at for after they've left you. Why do you think informed consent is really important in terms of fillers?
Let's say you told them what could happen, they know what can happen, they're saying yes, I still want to do it, and then if something does happen to them, that is kind of not their own fault, but they can't turn around and say, well, you know, you've done this to me, you've already told them this can happen, so they can't sue you, they can't basically ruin your reputation or anything like that.
Yeah, I totally agree. That definitely is really important, making sure that they know what they're going into, and then if there are any complications, they were aware of them up front, and they, you know, they can't really apportion blame on really knew what they were getting into beforehand. What would you do if you were completing a consultation with a client and it became clear that they weren't really sure about the procedure, they hadn't quite
I've given time to think about it.
What about yourself?
Try and explain it in a different way so they do understand. And then if they don't understand, probably just leave it for a while and then get them booked in when they've done a little bit more research or made a bit more of an informed decision.
Are there any clients who you know can't give informed consent?
Makeup pastas?
Yeah.
Under
So,
age.
perfect, yeah, great. So clients, as we've already mentioned, under the age of to give that informed consent, but also those that maybe lack mental capacity. So you may come across clients who, from consultation, from discussion, they may be a little bit forgetful, or there just seems something that's just a little bit amiss in the conversation. There are also clients that we morally and legally can't treat if they lack that capacity to make that informed decision. What would you do if you did come across a client like that who doesn't fully understand the risks involved? How would you kind of approach that conversation?
Just let them down nicely. Just say that you legally can't carry out the treatment as much as you like to help them feel better about themselves. It's just, you can't do it.
I think I'd show them pictures of problems that people have actually had with their lips when they've had it done and stuff, just to put them off it a little bit, maybe.
Yeah, maybe that's potential. We could try that. I think it's really important that we remain honest, open. So just saying to that client, I don't think this is the right treatment for you, or I don't feel comfortable going ahead with this treatment for yourself. It's your responsibility as a practitioner to make sure that they are giving their consent freely and with all the information in mind, and you just don't think that you're getting that relationship with that particular client at the time. It is okay to decline people treatments if it's not right for them. Okay, so what we're going to do now, if everybody is comfortable moving forward, we're just going to do a little case study to kind of apply what we've already learned so far. So imagine a client has an allergic reaction to dermal filler injection. What steps are we going to take to support this client and help resolve this?
Antihistamines, monitor them, and look for signs of severe allergic reactions, like anaphylaxis.
Yeah, brilliant. Yeah, that's great. Yeah, definitely. So we are going to monitor the client. We're not going to just say, right, I think you're a bit allergic to this, see you later, bye. Because again, morally that isn't right. It's going to affect our reputation, and it just doesn't feel humanly right, does it? Anthony, anything you'd like to add? If you're with a client or experiencing an allergic reaction, Gian said we'll monitor them, we'll give them some antihistamines. Is there anything else you could do to support this client?
Maybe try and reassure them so they're not as worried about what's actually happening.
Perfect, yeah.
I'd say, so they don't panic as much, because panic can make things a lot worse, can't it?
Exactly that. So reassurance is key with your client. You're building relationship with them, you're building your reputation with them. You are their trusted guide as such. So you reassuring them it's okay, I'm trained in this sort of complication, I know how to support you.
Would you try and make them understand it's not your fault that this has happened? You know, because they might now think, well, I'm never coming back here again because you've done this to me. Would you try and explain a little bit, or after it's happened and they feel a bit better, would you try and
I kind of get
explain why it could have happened?
Yeah, I get your thought process there. I do get your thought
And
process.
think about reputation a little bit as well, because
Yeah.
I think if I went somewhere and I did an allergic reaction, even though you've already explained it to me, I think I would then still blame you.
Yeah, I do get your point there. I think at the point where you've got your client in your chair, kind of like, oh, I think I'm gonna. It's your job to remain calm. You're not trying to apportion blame. You're not trying to throw blame off you. Our client was first and foremost in that situation. I wouldn't feel like you needed to justify yourself in any sort of way, because that sometimes can work the opposite way, where somebody thinks actually they are to blame because why are they so defensive. I would think about those kind of repercussions after. First and foremost, in that moment, if your client is having an allergic reaction, it's all about that, and making sure that they remain safe, making sure that they remain fit, healthy and well, and that you're doing everything within your power to support them. If this allergic reaction became more severe, so you've given them the antihistamines, they've sat with you, and they may be struggling to breathe or extremely itchy, what would your next steps be? Do you know can you remember from your that. So seek medical advice. Anaphylaxis can be quite dangerous if not treated timely. Knowledge of having your EpiPen from your complication management is great. Perfect. So, at this point, I'm going to open up for any more questions, anything else that's on your mind.
I don't understand it, you've explained it well, so it's quite simple for me to understand.
Good. Brilliant. That's great to hear. So,
Actually,
go ahead.
if someone's having an allergic reaction and seeing fine when they've gone away, and antihistamines are taking it away, but it's not as severe as anaphylaxis, is it antibiotics that they would have to take administered by a prescriber?
Yeah, that could potentially be a course of action moving forward. If it was like a prolonged allergic reaction, it may be that we needed to do something like
Are they still your issue once they've left? It sounds horrible to say
Yeah.
that, but so if there's no allergic reaction here, what they've left, not a vascular occlusion, some sort of allergic reaction after, a day later, 2 days later, is that still your responsibility to get them through it and
So-
advise them? Obviously, common sense you would as a nice person,
Yeah.
but is that your problem?
So again, modelling, yes, it's also part of your ethics as a aesthetics practitioner that you'll do everything within your power, but you are not medically trained.
I've heard of people ignoring people, but obviously I know the person that's had it done, and then they message the practitioner after with issues, and then they just ignore them.
No.
So
So
that makes
yeah,
sense.
that morally is not right. So you are there for your client kind of end to end. You are not a doctor though, so there
Yeah.
may be times where it comes and you have to say to them, I'm not medically trained for this, or I'm not complication management trained to this element, so we are going to have to work with either your prescriber or go to the GP.
I've seen it online, I've seen people have like delayed allergic reactions. Obviously, because we're not medically trained, we won't always be able to tell it's like a delayed. Because I've heard of like people's filler and sort of flaring up like years down the line.
Yeah.
Would you just refer them back to the GP? If it's 2 years later and they say, oh, the filler in my face all of a sudden feels like really bumpy and swollen,
Yeah.
would you know to think, oh, you need to go to the GP, but it is probably a
Bit to do with your filler. Yeah, so your filler can sometimes swell, it can sometimes have something called an inflammatory response when you're maybe a little bit run down, not feeling so great. I suppose in those cases, they might not always come to you, and then it does probably feel like, oh, it's not my business. It's great to have that knowledge of, actually, you're saying you feel this way, it could be to do with the filler, but again, it's not your job to diagnose, you're not diagnosed, but making them aware that, you've said that it's swelling a little bit, that is perfectly natural. Try the antihistamines, if they're not working, you will need to seek medical advice.
Okay.
Cool? How are they feeling? All right? Yeah, are you ready for a quick quiz? Anything from you before we go on to the quiz, or are you
Just want to ask, what adjustments have you made during the presentation to engage the learners who might be struggling with the material?
So, do you mind if I go toilet? Can I go toilet now? Or should I wait?
Well, sorry.
Sorry.
No, it's all right. Just wait for me. I'll finish this question. Adjustments. So I feel like during the interaction, I've kind of paced everything for the learners. I am regularly checking in to gauge their understanding, making sure that they're happy for us to move on to the next segment when it's time to do so. I think when maybe some of the learners seem like they're not as engaged, or they are not speaking up as much, I've directly engaged with them just to understand that they are check that they are understanding what's going on, that they are keeping up with the pace. So I've kind of gone back and asked specific And I've also tried to make the session interactive, including the practical PPE, and then asking questions off the back of that. I will be making it more interactive as well at the end when I'm asking them to demonstrate it themselves, and also asking them how they will handle particular situations and try to really bring it to life by giving this case study and asking them to reflect on it.
Can you just describe to me how you're ensuring the learners fully understand the safety protocols?
So I've made sure that I've gone over the safety protocols quite thoroughly. I believe that I've emphasised the key points well at each step that's critical to client safety. I've asked them to repeat things back to me as well as some of the key protocols that I've kind of gone over them with them. At certain points I've asked them just to repeat it back to me to make sure that it has gone in, that information has been embedded. I also will give them a handout as well. Well, I've given them a handout around conjugate implications, but at the end I'll give them a handout to summarise some of the main safety things, just to make sure that the information that you've got today, you're going to be taking away and continue to learn and embed that as well.
How do you plan to assess the learners' understanding of the material you just presented?
So in a minute, after a little break, we're going to do a small quiz, and that will just make sure that the information that I've given you is embedded, that they're understanding it, that they understand the safety protocols that we discussed, and then encourage them a little bit later on to demonstrate their understanding by doing the practical assessment. I'll obviously be on hand to guide them through, give any in-the-moment feedback if something isn't quite going right, and yeah, just assessing how well they remember and apply the protocols in that practical session. So the quiz and the practical session. Brilliant. So before we go through with the quiz, we need some refreshments and some no conferring around the quiz.
Okay.
Just leave it off. It's not intense.
Okay.
It's just to make sure that you're taking in the information. We can go over anything that maybe we need to answer. So, question number 1: how would you disinfect a metal instrument?
Using Milton or I completely forgot the name of the machine now.
The autoclave.
Yeah, the autoclave.
Autoclave. Yeah, brilliant. Well done.
And can we use wipes as well?
Yeah, you could use a wax. I'm not as intensive, so we suggest that you use the autoclave as your number 1.
I'd say, like, depending on the instrument as well, when the wipe you wipe the surface, couldn't get inside things, you could get, you know what I mean?
Perfect,
You
great
want to fit
insight. Yeah, definitely. I think that's really great insight. That's well done. So metal instruments, autoclave, the Milton solution. You can also use UV light as well to disinfect some metal instruments, but it's not as common within our industry.
Could we use, in hairdressing, we used barbicide to sterilise scissors and stuff. Can we use that? In metal instruments?
Yeah, it's similar to the Milton. It's just another sterilising solution.
Yeah.
Okay, so question number 2. Why do we use nitrile gloves instead of latex?
Because people could be allergic to latex.
Perfect, yeah. Question number 3. What is a common contraindication for dermal fillers?
That's not what I mean.
Right, well, why don't you both hazard it?
I'll go first, it's like an easy one. Bruises.
Bruises, yeah. Oh, no.
Did I say that wrong?
Contraindication. Sorry, yeah, I'm thinking you did it right and you
sorry.
haven't. Wrong question 3. So contraindication, so something that means you can't complete that.
A cold sore, I forgot the name there.
Cold sore, yeah.
Active infection, bloodness,
Perfect.
any. Can I go to notes?
Yeah, you can. Yeah.
Diabetes.
Perfect. Yeah. That's exactly why you've got notes. That's exactly why I've given you them to take away. There are a lot of contraindications, but great recall for some of those. So Anthony, this question's for you. So name 2 potential complications in a dermal filler procedure.
Is bruises a complication?
Yeah, bruises
And then
complication.
obviously a vascular occlusion.
And vascular occlusion, yeah. Adrienne, can you think of any complications?
Swelling, infection.
Infection, brilliant, yeah, great. And then name at least 2 types of PPE that should be worn.
Apron, gloves. Gloves is most important.
This is the most important, yeah, brilliant. Great. Any questions? Anything on your mind? Okay. So, just before we get to that part, so no questions, definitely no questions.
I don't think so. I might have some later, but
As well.
I tend to think about things when I've gone home and then I'm like, oh, should have asked that. But
Always
For
feel
now.
free to reach out and
Yeah.
if you have any questions. It's better to get that clarification before you go ahead and do anything.
we just message you if you have any questions. Is that?
Yeah, it's that same communication methods that we've had before, so yeah, just drop me a message if you do have any questions after and we can look at supporting you with those. So before we move on to the final part and the summary, I just want to test a little bit more of your knowledge. So obviously I did speak about this earlier. We're going to do the practical. So I demonstrated popping on that PPE. There was a specific process that we needed to follow. There was a specific order that we needed to follow. Before I send you on your way today and before we conclude our session, I just want to test your knowledge of that process. So you'll see on your tables or on the table that we've got all of the correct PPE. I want you to just have a look at getting yourself set up. We'll do one at a time just in case something does go wrong or something that we're not, that we need to talk through. Any volunteers for yours?
Can I go first?
Bam, okay.
My hands twice.
So when we're washing our hands, what areas do we need to remember?
Under the nails and in between the fingers.
Fabulous, yeah, brilliant. When we are drying, what do we need to think about?
Make sure, well, let's
in donning your correct PPE.
Taking your mask.
Yeah, so kind of.
Fold it open.
Yeah, just start on here.
You're going to have pink ones in your pen.
He's already got them.
Make sure I'm covered up as much as possible. with the
Yeah.
apron. And then obviously the gloves I need to, well, I'm not going to waste a pair by checking the size, but I'm assuming I'm a medium, not a small, because they're man's hands. So I'll try these out and make it a
Give
bit.
them a try.
Oops, supposed to be one at a time. No, see, too small.
Yeah,
They've
so
got-
exactly, we don't want to try those ones are hard. How do they feel? Yeah?
Yeah, that's better.
Brilliant.
Should I not use that hand to get the glove out, or should I use my, which hand? Would does it?
It doesn't really matter because you've already cleaned your hands.
It's perfect.
Fabulous. Any other steps?
Which way?
Trick question. No problem. So, you're going to take
Oh, yeah, I'm
all
gonna-
those off.
Yeah, I'm going to go to the bin and do it at the bin so I don't leave anything anywhere.
Perfect. And
I will
when
grab it from the tip, like that,
Yeah.
pull it down,
Yeah.
put that inside that one, basically, and then grab it from the tip. Touch the least amount of the glove as possible.
Perfect.
Take it all off, put it in the bin, wash my hands again.
Fabulous.
You too.
Thank you, Anthony. Great. Any feedback from Anthony there? Do you have anything that you observed that you thought you could do differently, or?
I think you took your apron off before you took your gloves off, just for blood spills and stuff, because if you take them off and then touching your face after you took the gloves off.
Yeah.
Yeah, brilliant. Yeah, perfect feedback. So yeah, and so just bear in mind that when you are doing the zip process, just take that apron first. Right, Adriana, you're up next. Yeah, right between those fingers. Good technique. So can you see the importance of the fact that those tissues come from that dispenser quite easily
Yeah.
without you having to touch anything?
And I guess that rather than a towel or something would just multiply bacteria, unless you're washing it after every thing you touch.
Yeah, which isn't realistic.
Okay, so I'm going to do my mask first. I guess this is why I like hair wash as well, so you're not like touching your hair or anything.
Yeah, so first and foremost, so it's not getting in the client's face, it's not spraying anything anywhere, but also, yeah, it just makes it much easier when you've got your PPE on.
How do we open this again?
So yeah, you kind of start at the top, you can kind of open it up and see that that just pops over your neck. I like opening them up once they're actually on my body, but you'll find a way that's comfortable.
Okay. I'm guessing medium.
So it's nice and snug without being too,
I ripped it, so at this point I would just change my glove.
yes.
we can have ripped it, but I don't want to waste it.
No.
But I want you to know that I've changed it.
So snug but not too tight.
Yeah.
Feel like you can still work and feel comfortable in those.
Yeah.
Fabulous. Yeah. Great stuff. Just want to pop that up. Oh, she's left with her apron on.
Oh, I did not ripped it.
I think it's stuck to your yeah.
Front wrists,
Perfect.
turn inside out. Okay.
Yeah, fabulous.
And then wash my hands.
Perfect. Great. So hopefully just by doing that, it's kind of embedded a little bit more within your mind. Are there any questions, any thoughts off the back of the practical? Cool. So, do you guys have any feedback for me?
I think you've helped me quite a lot. You talked loud enough because I can only really hear out from here anyway, so you were quite loud and repeated anything that we didn't really understand, which helps me a lot. Sometimes I do need things repeated back to me because it doesn't always go in. I'm more of a hands-on.
Good. No, good to hear, and thank you for that feedback. Anthony, is there anything from yourself, anything that went well or
Having all the stuff like, do you know, me, like, I like to actually physically see things and stuff to learn, or I'll get my hands on and learn, rather than just listening. I'm listening, it sort of goes through one ear and out the other, you've got pictures on here, plus the writing, plus you're explaining it, so it's just made it,
all the more?
yeah, you've done
Great, thank you very
Perfect,
much,
Just
guys.
one question. Are we allowed to take photos of everything that you've got out today at the end, just so that I know what to...
Of course.
Yes. So I know it says on my kit list, but sometimes it's better to just refer back to them.
100%. If you want to take photos, feel free to do so. I have supplied you with the notes and everything from today as well, so get those all sent through just so you can refer back to them if you like that for your learning. And, you know, you've got your handouts as well, so
Yeah.
make sure that you constantly refer into those if you've got any issues, anything that's on your mind. Also, feel free to contact me if there's something that I've missed within the training and needs to be covered, or something that just didn't quite sit totally right today. Obviously, constant feedback, constant being able to change these to make them right for our clients is paramount for me and my business and moving things forward, making sure that I get the right outcomes for everybody that I'm trying to support. Is there anything in the moment where you're thinking I could have done something a little bit better, something a little bit different that would have maybe helped you a little bit better? Is there anything you can think of now?
Maybe some video demonstrations, perhaps.
Yeah.
Because I like videos. More than videos. I prefer watching videos. Just it makes a little bit more sense to me. Finding out things.
I do really appreciate that feedback. It is something that I will definitely take into mind.
I don't like giving feedback, so I feel like when I'm giving feedback, I feel like I'm criticising what you've done
Yeah.
and you've done well, so like I never, every course I've done I never really give feedback. If I've enjoyed it, and I think, you know, I've learned what I've come to learn,
Yeah.
I won't get much feedback out of me. You've done well, so.
Perfect. Brilliant. Well, that's great to hear. If you do change your mind at any point, or you know, like you're sat in bed and you think, oh, actually, this would be beneficial, or you could have maybe done something a little bit different, please reach out to me. I think feedback's a gift, you know, like it can only help me constantly grow on what we've already got going on here. So, any questions, anything really, moving forward, if you need me, you know where I am and how to contact me.
It's the wrong way around.
That's everything, guys. Any more questions? You've got your contraindications.
Hands out.
Great team.
Thank you.
Thank you. Nice to meet you, Rachel. Bye.
How do you feel that went?
Yeah, I think it went really well. It was nice to get the feedback at the end around, it's good to get the feedback of what I can do differently, but also the feedback of I think you've done really well is a nice feeling. It's good to know that the student was responsive to what I've been teaching them.
So, what do you think went well in terms of meeting individual learners' needs during the session?
So I think I was able to engage both of the learners really well. It was evident it was from a combination of the methods I used to do the teaching today. So, visual learners saying it was nice to have everything on the screen, getting that feedback that I've kind of had the real life stuff here for them to touch, to feel, hands-on components. I think just the positive feedback from the students has been, it showed that they understood the material, understood the outcomes that they're here to learn, and I think they'd love to move on from that.
In hindsight, is there anything you could have done differently to better engage learners?
Yeah, definitely. I think Ashlan's feedback around the videos is definitely something that I need to further think about to engage my audience. Specifically around elements where I don't have the physical equipment within my practice. So that was an autoclave. I use single-use products quite a lot. So it would have been good to maybe show them a video of an autoclave how it works, because I don't have anything here for them to be able to see that directly. Maybe also allowing the learners to reflect on their own personal experiences a little bit more. I'd probably expand on that next time. So I do feel like I asked them a lot of questions around, have you ever experienced this? What would you do in this? But I didn't maybe give them the opportunity to answer in depth. I just allowed them to have an overview. So next time, I'll probably give them an option to answer more in depth.
Perfect. How did you adjust your feedback based on different learners' responses and engagement during the session?
So during the session, I believe that I used positive reinforcement. So where an answer was correct, I think I was really positive and used language like, oh, that's great, that's exactly right, well done. But in cases where I maybe didn't give the correct answer, rather than saying, oh no, that's not right, that's wrong, I was still very positive and allowed them to expand on that idea or think about alternatives. So, for example, I think it was Anthony who had made a point around the vascular occlusion and first opened the floor to Adrian, so he had that peer-to-peer understanding, but then I went into more detail around that, so that he didn't feel like, oh no, you're totally wrong. It was more of an open conversation, and as a team we could then get to the bottom of that particular aspect of the learning to make sure it was right. I do also have plans to meet up with them both one-to-one to give them feedback, and also allow them at the forum to ask more questions if we didn't feel comfortable answering these for them. both went through periods of being a little bit shy, or maybe not talking up as much. But when I felt like one of the learners wasn't as engaged, I was directly asking them questions just to ensure that they were engaged, that they were still on track. So making sure that I was really concise as well and checking in with them, the instructions.
Okay.
And I also made sure that before moving on to the next topic, I checked that they were comfortable to do so.
Perfect. What worked well in this assessment session, and where do you see room for improvement in your own assessment practice?
So definitely worked well with the combination of having the visual presentation, the aids, and the practice. I think having different kinds of techniques to deliver the trainings work very well. I do think that I could maybe have had more hands-on trainings, especially for a kinesthetic learner. They're going to learn more by doing more hands-on activities, maybe. And probably just being a little bit more mindful of the pacing. I feel like my pacing was right for the group of this size, but moving forward for other groups, we do just need to make sure that where there may seem like there's a student that's not as engaged, am I pacing it right for that group?
And lastly, what additional resources or strategies could you implement next time to ensure more effective learner engagement?
So from direct feedback from Adrienne, I'm definitely going to look at implementing more videos for that learner engagement. I think also more case studies. We obviously covered one case study as part of that teaching session, but again, for maybe larger groups, it would be more beneficial to have more case studies so that it's promoting that peer-to-peer conversation, so that they're supporting and sharing ideas through that. And make it just feel more interactive as well if they're doing more case studies. Encourages more critical thinking as well, case studies do. Probably I'm also going to look at probably more the feedback system. So I felt that the feedback system in my loop here was a little bit lacking. Obviously Anthony quite openly said he doesn't like giving feedback, and that might be because it feels quite confrontational in an environment like this, giving me direct feedback. So I think I need to look at how my feedback system can be a little bit different. Perhaps looking at sending that as a follow-up rather than in the moment, just so that they feel more confident to be open and honest. Maybe getting them to assess their own abilities as well, actually, moving forward. I think that would be beneficial, actually reflecting on things. Because if they reflect on their own progress, they're going to take more control and ownership of their learning.